How specific is the Ca-19-9 blood test for pancreatic cancer? Imagine trying to find a tiny needle in a haystack. That's similar to how doctors use blood tests like the Ca-19-9 to detect pancreatic cancer. This test measures a protein called carbohydrate antigen 19-9, which can be elevated in people with pancreatic cancer. But it's important to understand that this test isn't perfect. Its ability to correctly identify people without the disease, known as its specificity, is high but not absolute. Usually, the specificity ranges from about 82 to 91%, meaning that most people without pancreatic cancer will have normal Ca-19-9 levels. However, some conditions can cause false alarms. For example, gallstones, liver cirrhosis, or bile duct blockages can all lead to elevated Ca-19-9 levels, even if a person does not have cancer. The test is also not foolproof in detecting all cases of pancreatic cancer. Some patients, especially those with a certain genetic makeup called the Lewis negative phenotype, may not produce enough Ca-19-9 to be detected, leading to false negative results. This means that even if someone has pancreatic cancer, their Ca-19-9 levels might not be elevated enough to show up on the test. Because of these limitations, doctors do not rely solely on Ca-19-9 for diagnosing pancreatic cancer. Instead, they use it alongside imaging tests like CT scans, MRI or endoscopic ultrasound, and other diagnostic procedures. The blood test is particularly helpful for monitoring treatment progress. When treatment is working, Ca-19-9 levels often decrease. If levels go up, it could indicate that the cancer is progressing or coming back. Preoperative Ca-19-9 levels can also give clues about prognosis. Higher levels before surgery are generally associated with a poorer outlook. But again, these are just pieces of a larger puzzle. No single test can definitively diagnose or rule out pancreatic cancer. That's why it's essential to consult healthcare professionals who can interpret these results in the context of symptoms, imaging, and other findings. In summary, while the Ca-19-9 blood test is a valuable tool in managing pancreatic cancer, it is not entirely specific. It's most useful when combined with other diagnostic methods and clinical judgment. Always seek personalized advice from medical experts to understand what your test results mean for your health.